Well, welcome back, everyone. Colon cancer is one of the most preventable and treatable cancers when it's found early. But many people still put off getting screened because they don't know what to expect. Well, today we're talking with Dr. Shannon Wesley, Lima Memorial Health System proctologist. And she's going to walk us through what a colonoscopy really involves and also why it could save your life. So thank you so much for joining us.
Thank you for having me.
All right, so can you explain what exactly is a colonoscopy and also what is it, what does it allow you to see and also detect?
So colonoscopy currently is the gold standard in treatment for what we use for screening for colon cancer. Colonoscopy is where I or somebody takes a long camera and we're able to look at the large bowel, or what we call the colon, and this is the screening mechanism in which we look for growths, or what we call colon polyps. There are certain types of colon polyps that do or can turn to cancer, and the purpose of the colonoscopy is to use the camera in our eyes to look through the colon and have the ability to remove those growths before they become colon cancer.
All right, so people often worry about the procedure itself. So what is it really like from a patient's point of view?
Well, as somebody who has a family history of colon cancer and has had several colonoscopies herself, I think the fear of the unknown can be very scary. I think we worry a lot about what goes into getting ready for the colonoscopy until we have to think about what can happen during the colonoscopy. And I think that's kind of where people get scared. And the truth is if we follow the guidelines, we do screenings, we understand our family history, when we have a colonoscopy, we're typically just in there removing a couple polyps. And that's pretty simple. And we just see each other every few years to have that redone and the ability to remove those polyps before they turn to cancer.
Right. So many people say the prep is the worst part. So what does the prep involve? And then also, how can patients make it easier?
When it comes to a colonoscopy, I think by far the prep is what everybody wants to avoid or try to maybe tweak a little bit. Over the last 10 to 15 years, we have really developed new preps that tend to be easier on patients. We used to have large volumes of liquid that maybe didn't taste so well. We are moving towards pills and using pills as long as patients can take pills okay, and less volume. Unfortunately, we do have to get the bowel cleaned out because polyps are tiny and we have to be able to see them. So we need to have good visualization inside the colon. So the name of the game of getting the bowel cleaned out is never going to change. We're just going to get better at how we're doing it.
Right. So why is the colonoscopy so powerful when it comes to preventing cancer, not just detecting it?
So there are multiple ways to screen for colon cancer. There's still multiple things in the algorithm that we use every day to screen for colon cancer. The thing about a colonoscopy, it's actually the only way that we can truly visualize the inside of the colon and remove what we see when we see it. We have other modalities to see the inside of the colon and the ability to see if there's a polyp there. Unfortunately, there's no way right now besides physically having a colonoscopy and having someone in there to remove those lesions or polyps while in real time.
All right. So how can someone reach out and schedule their screening?
They can call my office. They can come in. We can have a conversation. Of course, if they're 45, it's time for a screening. If they're past 45 and never had a colonoscopy, it's time.
All right, fantastic. Well, doctor, thanks so much for joining us today. Appreciate it.
Thank you.
All right, well, don't go away because we have more when we return.